Good morning, everyone. Thank you so much for joining us. We'll get started in just another couple seconds here. All right. I'm going to get started because we have a lot of really great information to share, and I want to make sure we have time to get through it so people can catch up on our introductory slides here. My name is Rebecca Miller. I'm an attorney at the Western Center on Law and Poverty, and I am thrilled to be here with a number of my fabulous colleagues, Whitney Francis and David Kane, Keely O'Brien, and Sandra Poole. And we are using this last and final webinar of Western Center's summer series to take a step back, find a little kernel of hope, and think a little bit about a reimagined, think about like what the future could look like in California and California as a model for the country in a couple of key areas of Western Center's work. And so we are going to talk about that. Maybe we'll move to the next slide. The goals for our training today are to talk about some of the different advocacy strategies that can be used to achieve a policy change on this level of reimagining a system. And we'll talk about the things that Western Center employs and that we necessarily employ together with our partner organizations and clients and individuals throughout the state. We're going to take a deeper dive with our other panelists into a couple areas, healthcare, financial stability, and thinking about how we fund these systems in an equitable way. And then we'll talk a little bit about marrying those two things together, how the advocacy strategies that organizations like Western and our partners can be used to help us achieve these visions moving forward. So just quick housekeeping tips. I feel like we're all so familiar with Zoom these days, for better, for worse, but please feel free to use the closed caption icon in your toolbar if you need that. We really invite you to submit questions or comments using the you can raise your hand, use the Q&A or the chat section, share other resources, raise any technical issues or accessibility. Um, uh, Oh, accessibility issues. Is my audio going out for other people? Thank you, Amy. It is. Oh no.
It's a little crackly.
Ah, it's a little crackly. All right. Well, maybe I'm gonna go closer to my internet router for a second. And
Going camera
while we
off
do the poll.
sometimes helps, Rebecca.
All right. Is this a little bit better? Yes. Oh, great. Well, I will rely on my photo then and not my face. So we're just getting a sense of who's here today. Please fill out this attendance poll and let us know so we get a sense of which organizations and are joining us. Thank you. All right. Should we move on to our next slide? Thank you all. Um, So I'm going to talk a little bit about some sort of the advocacy tools that Western Center use through an example of some of the work that we have done together with our partners on the issue of ending um, administrative fees in the juvenile and adult criminal legal systems in California. And we talk about this as ending racialized wealth extraction in these systems because they so predominantly impact low income and communities of color and have a compounding and incredibly negative effect on those communities. So, next slide. So, a little bit just about Western Center, and because I think it's important just to think about who we are as an organization. And again, I'm going to keep saying Western Center and our partners and our coalitions because Western Center I have an incredible amount of pride and we're a special organization, but we really only operate together with our partners and our coalitions around the states. We were founded in the 60s about to really to sort of, and the first issue was like thinking about bringing really quality litigation on behalf of low-income Californians, and we've expanded to have a lobbying office in Sacramento. So we have an incredible team of lobbyists who work there, and then we have really it's sort of like fleshed out the toolbox of advocacy strategies that we use and we bring to an issue to make sure that we can be as successful as possible, as nimble as possible, and really push it forward, and especially in this kind of work that we're talking about today, where we're reimagining an existing system. Next slide. So at the Western Center, we talk about our wheel of advocacy. Um, Sometimes the slide has text associated with it, which I don't know if it's like but we do, there it is. It's animated. We really we approach the work from so many different perspectives. We have a number of litigators and we have a number of lobbyists, but we really do approach it from all different angles. We might be doing litigation on something. We are also doing support center work where we work with individuals, with organizations that represent impacted individuals. We do skills training to help what do advocates need to better serve the communities that they're working in so we can bring that information, that skills to communities. We do our legislative and budget work. We also do a lot of administrative advocacy with public agencies because you can get a court decision or you can get a law passed, but how it's implemented can be just as important, if not more, in terms of the how we're able to multiply that victory and make it be real for the individuals that it's supposed to benefit. Um, Next slide. So just a little bit back to the issue of fees and the work that Western Center did in this area. So we have our like substantive areas of litigation, lobbying, um, and support center work, and our administrative advocacy. And what that kind of looks like in the course of a campaign when we have identified something that we want to work on is, first of all, we always bring the value to our work of making sure that we are centering the voices and the perspectives of people who are most impacted by the issue. This can be because we are representing individuals in litigation. It can be because there is a campaign being led by organizations that are membership organizations of people who are impacted by an issue. But we always want to make sure that we are centering that in our work and in the solution and the vision that we are working towards. We also are gathering information. We rely a lot on Public Records Act requests, both to support our litigation and any of our narrative change work, as well as our legislative campaigns. Sometimes shining a light on what's going on in the government agencies and being able to tell that story is one of the most powerful tools. We use that information in reports, communications work to change the narrative about an issue that was incredibly important in the fees, eliminating administrative fees space. We'll use litigation to put pressure, both to put pressure, but also to call attention to the harm that a policy can have on people. But as we all know, I know there's a lot of lawyers on this, litigation is an imperfect tool. You can't always accomplish everything, and that's why it's so important that we're marrying that litigation work with all these other advocacy tools. We often are doing litigation in combination with a legislative campaign, either before or after. Sometimes the litigation calls attention to an issue and might be able to achieve a small part of it. And through that work, then it sort of softens up and creates the right soil and environment for a legislative campaign for us to change the law altogether. And then I've already talked about implementation and monitoring, doing administrative advocacy with the government agencies, and then making sure both people who are impacted by the issue and advocates who are representing them understand the changes, understand what the possibilities are bringing implementation gaps to our attention, are we're able to promote best practices and really build off the change that we were trying to achieve. All right, next slide. So what this has looked like in the administrative fees space in California, this is something that has been going on for longer than I've even lived in California, but for over 15 years. Organizations in the state started working on bringing attention to this issue. It really started with the issue of juvenile fees in Los Angeles, and another youth organization in Contra Costa brought this issue to attention. Young people would leave the juvenile system, and their families would owe between $8,000 and $12,000 in administrative fees for time a young person spent in placement, for public defender fees, all kinds of other administrative fees that were being imposed on families to fund the carceral system. And so then from there was there was a lot of information gathering, Public Record Act requests, particularly in some of these systems, there's not good information out there to share and to kind of point out what was going on. And sometimes just being able to present the full picture of the information can help start to shift the narrative. Like in juvenile fees, that millions of dollars of juvenile fees were being imposed on families, and only 10 to 20% of it was ever being collected. So families were being burdened by this, stressed by this, relationships were being stressed by this. It can lead to recidivism. It can worsen housing and employment outcomes, and for no aside from all the other harmful reasons of these fees, but for even the stated government purpose of collecting revenue didn't exist. And so that was incredibly powerful information that we had. People also shared their experiences about what happened, and that led, and there were local campaigns both in Los Angeles and Alameda and several other Bay Area counties, and that led to those local counties repealing their fees. And in some cases in Contra Costa County, even repaying families for some fees that had been charged to them. We partnered with UC Berkeley's Public Advocacy Clinic, which brought an incredible amount of leadership and resources to the issue and doing statewide reports that changed the narrative. And when this issue started, I think we're all familiar with this accountability narrative of, people who end up in the carceral system are there because of their conduct, and that this sort of charging people these fines and fees is part of the accountability process. So we had to undo that narrative and talk about how that this was not in the family's interests, it was not in the state's interests, it was not in the local government's interests, and it was based on racist and classist stereotypes. And it was also causing an incredibly disproportionate impact on some of our most vulnerable communities. So we had to work on that, and it's really incredible to have been part of this. I feel like caught the wave of this movement when I moved to California and got to work on it, and I'm so honored to have been part of this moment in time where this happened. Now, often when we sit in policy conversations in rooms with all different stakeholders, some of the things that were so hard to get people to accept are just accepted. And so we really it's been amazing to see that. And that kind of fundamental narrative change is really important for being able to achieve some of these other visions. The juvenile fee campaign led to legislative changes. It led to implementation monitoring to make sure we had. There were lots of times where the legislative victories didn't result in the change on the ground, and we had to catch those. And then there was litigation follow up. We had a class action lawsuit in Riverside County where we sued the county for not following due process in assessing fees. They canceled all of their fees and paid families back $500,000 in fees that they had collected because they hadn't been following state law. And we eventually led to a second legislative campaign where we eliminated all juvenile fees, past and present. And that has spearheaded the sort of leap into the adult fees. And there's continued work in coalitions in California on restitution and other costs of incarceration. And so it was like building all these different advocacy tools, changing the narrative, coming at an issue from so many different perspectives, which allowed us to take a system which had been operating without anybody questioning it for so long in a certain way, to get to the point where we could re-envision it and have the one of the main coalitions that works on this is debt-free justice. Have not impose additional debt on families, counterproductive, harmful, extractive debt that is undermining our state's goals and our state's values. And that's it. I'm going to now pass it over to Sandra, who's going to talk about how Western Center does some of these same things in healthcare.
Thank you, Rebecca. And thank you all for joining this afternoon. I'm going to talk about an area that is ripe for us to make some changes to ensure that everyone gets health care. And one specifically, I'm going to talk about single payer today. It's something that you've probably heard about. And so I thought we would talk about the definition, how it works, some international and national models, as well as what California has done, and then quickly go over some pros and cons and to leave you with some thoughts about what you think should be the next step. Next slide. So in terms of definition, single payer healthcare is a system in which one public entity, and it's usually the government, that finances healthcare for all residents. And a couple of the key characteristics is this universal coverage. That means everyone is covered. The government pays most of the medical bills, and providers may be public or private. And then typically funding comes from taxes. But the goal is to ensure that all residents have access to healthcare, regardless of their income, employment, or health status. Next slide. So what's the difference between what we have now and single payer? Under our current system, you all know we have multiple insurers. A lot of the insurance is employer-based, and there's significant administrative complexity in our current system. After the Affordable Care Act and prior to some of the things we'll see with HR 1, approximately 90% of folks were covered, but it was not universal coverage. Under a single payer system, there would be one primary public payer. The coverage is independent of employment, a simplified administration, and again, universal coverage. Next slide. So there's some countries right now that have been already implementing a single payer system. Canada is probably the one you hear most often and is most well known. Their provinces administer healthcare. It's publicly financed for the physicians as well as the hospital services. And private insurance is used mainly for supplemental, those specialty services. In addition to Canada, Taiwan established a national health insurance program in 1995 that covers nearly all of their residents. South Korea also has a universal coverage through a national health insurance program. And then Norway and Sweden also have tax-funded systems. I want to note that generally these countries spend less on administration than the United States while they're achieving universal coverage. Next slide. So some of the outcomes for these international programs, some of their common strengths are the universal access to care, the lower administrative costs, better financial protection from medical bills for consumers. And another one was the longer average life expectancy than the United States. Of course, common challenges are budget constraints, wait times for elective procedures, the normal political debates over taxes and spending, and then also there's some workforce shortages in some regions. Next slide. So what have we done in the United States? Vermont in 2011 passed legislation that established their Green Mountain Care program. It is the nation's most advanced single payer system initiative, and they sought universal coverage through a publicly financed system. Unfortunately, the implementation of that program was abandoned in 2014 because of concerns over financing and potential tax increases. But Vermont to this day remains one of the closest of any state to come close to establishing a true single payer system. Next slide. Other states such as Colorado have tried to get a program established. They did theirs through ballot measure, and it was Colorado Care Amendment 69, and it would have provided universal statewide coverage, replaced most private insurance. However, it was rejected by the voters by 80%. I think the opposition did a pretty good job of putting a scare tactics in. Other states exploring variations are New York, Washington, Oregon, Minnesota, and Maine. But most of those proposals have also stalled because of funding concerns and federal legal barriers. Next slide. So what has California done? We have actually considered single payer legislation for decades. Starting in 2006, then Senator Sheila Kuehl introduced a bill, Senate Bill 840, which would have provided single payer and universal coverage. That bill was vetoed by then Governor Arnold Schwarzenegger. So tried again and introduced another bill in 2008 with the same number, and he vetoed it again. The governor, in his veto message, felt that these bills were establishing socialized medicine, and that was the basis for his veto. However, there's been continued advocacy. There's labor organizations, physicians. The California Nurses Association has been very active in this area and have been a major supporter of this concept. Next slide. A little bit more recently, then State Senator Ricardo Lara introduced SB 562 called the Healthy California Act. And that was another proposal for universal statewide single payer system. It did pass out of the Senate, but it was stalled in the Assembly and ultimately shelved. The reasons for some of the problems with the bill was that there was a feeling that there wasn't detailed financing mechanism. There were questions about the need for federal waivers and concern about implementation costs. Next slide. Moving a little bit more recently, Assemblymember Ash Kalra introduced the CalCare Act, that was AB 1400, and it would cover all California residents. And now this bill included medical, mental health, dental, vision, prescription drugs, and long-term care. And it replaced most private insurance with the state administered system. The bill did advance through the committees, but it was withdrawn before a floor vote because they didn't have enough sufficient votes for it to pass the floor. There were other efforts in 2023, AB 1690, in 2024, AB 2200. And then most recently this year, in February, there was a bill introduced, AB 1900, that unfortunately failed to get out of the first policy committee. So as you can see, California has tried and tried to get this done. And it's interesting because there's research. The David Binder did research that nearly 2/3 of California voters want to see transformational changes, not minor reforms to California's broken healthcare system. So the public is willing, but we've got to get everybody else on board. Next slide. So some of the pros of a single payer healthcare system is universal coverage. Everyone's covered regardless of their employment or income. There's lower administrative costs, reduced financial barriers such as medical bankruptcy and large out-of-pocket expenses for consumers. The government would have greater bargaining power to be able to bargain some of these costs and improve equity. So there'd be more consistent access across populations. Next slide. The cons are those that we probably hear a lot. Potential for higher taxes, government budget pressures. That's when the health spending competes with other public priorities. And then the potential wait times for non-emergency procedures is often a complaint in this type of a system. And difficult transition. I think this one is a big one. Moving from the current system would require major changes for employers, insurers, providers, and consumers. Next slide. So key takeaways, single payer uses one public payer to finance for all residents. There are countries that have done it and implemented successfully. It seems like within the states, Vermont came closest, Colorado rejected, but there is continuing efforts to get it done, even as recently as this year in California. So the debate centers often on, do we want broader coverage and simpler administration versus higher taxes and implementation challenges? So just food for thought. Should California continue pursuing a single level payer healthcare system or focus on expanding the coverage that we currently have? That's it, and we'll move on to the next presentation. Thank you.
Thank you, Sandra. So I'm gonna be talking today, just exploring the role of guaranteed income in our reimagined safety net, and we'll go over what is guaranteed income, why it's important, just the current landscape, and the potential future guaranteed income. So to start jumping in, what is guaranteed income? I want to first start by clarifying the difference between universal basic income or UBI and guaranteed income, since these terms are often used interchangeably to refer to guaranteed income programs, but there is a distinction between the two. So, although the many UBI proposals might differ slightly in their details of what the program entails, UBI is defined by five core features. That's the allowance is distributed in cash, and they are regular payments to individuals. They are unconditional and they are universal, meaning for all, regardless of income or need. So under UBI, someone making, like, say, 250K a year would be receiving the same amount as someone making 25K a year. And so while universal basic income is a regular cash payment to all members of a community, guaranteed income is a more targeted, focused program focused on specific individuals or families within a community, ensuring that those with the greatest need are prioritized. Because when the most vulnerable members of our community can thrive, then our whole community stands to benefit and thrive as well. And this isn't a new idea. Martin Luther King Jr. called for guaranteed income or having an income floor, which no one could drop below in 1967. And there was a effort in Congress that to have like a guaranteed income for families that was introduced under Nixon in 1970s. So this is an idea that people have been thinking about for a long time. Next slide, please. So why guaranteed income? Why does it work? Um, if you really break it down at the very basic level, poverty by definition is a lack of access to cash. So what better way to perhaps tackle that issue than putting cash directly into the hands of those in need? And unrestricted cash offers people the most autonomy to determine what their needs are and where to best spend that money, and offers more dignity than our traditional welfare program since people don't need to jump through hoops and various like bureaucratic administrative hurdles to receive and spend that money. And research on guaranteed income and cash transfer programs are continually showing that guaranteed income is an impactful tool in helping to alleviate poverty, and by extension, um, has other beneficial impacts on health, housing, hunger, and safety, and more. Next slide, please. So, evidence from guaranteed income continues to demonstrate meaningful outcomes across many issue areas, including things like reduced stress and improved overall well-being in the maternal child health space. These outcomes include healthier pregnancies, reduced rates of preterm birth, increased access to care. Participants also have experienced increased housing stability, reduced eviction rates, improved greater access, ability to pay for rent, um, and uh, employment with better access to stable, higher quality jobs and workforce opportunities. And I think a great example of the benefits and impact of guaranteed income that we all have experienced are the rounds of stimulus checks and tax credits that the federal government enacted during the pandemic to keep Americans out of poverty while we were sheltered in place and while many households experienced a lot of financial hardship resulting from things like job loss, a lack of childcare, etc. During that time, as a result of federal action, poverty dropped by 67% nationally in 2021, which is the largest and most effective anti or poverty reduction policy that we've seen in the past 50 years. Um, so just the potential impacts and or the real impacts of guaranteed income or direct cash assistance is really huge. And I just want to know, one critique of guaranteed income is whether the benefits of it can be sustained beyond what are often like these time limited programs, whether it's like 12 months to 18 months. Or is often the duration. Some people worry that pilot or participants would just revert back to their prior conditions after the program ends, since it's more of an individual level intervention rather than a systemic level change. But however, guaranteed income offers an opportunity to disrupt systemic inequalities that can really help to shift the trajectory of someone's life. So, um, preventing eviction, breaking the cycle of homelessness, supporting reentry populations as a mean to reduce recidivism, supporting foster youth and then their transition out of the foster care system. Maybe it can also be the difference between a family getting CPS involved, and overall just alleviating child poverty, which has like a major impact across the life course. So this one-time thing can have a longer lasting impact beyond the program duration, by really intervening at a critical point in people's lives. Next slide, please. So there's various ways to get cash into the hands of people with them with the most need, with each with their varying pros and cons. I view there to be like three main strategies. The first being through tax credits, like the earned income tax credit, young child tax credit. We can also transform our existing public benefit system to be more guaranteed income like and getting cash into people's hands. Um, like the CalWorks program. And then there are also like what we traditionally think of as guaranteed income through like the public-private partnerships to get pilots off of the ground. Um, and all of these are critical part of our effort to reduce poverty in California and lift families out of deep poverty and address, or at least try to start to address income and wealth inequality. But for today's conversation, I'll just continue to focus on guaranteed income programs, but just wanted to acknowledge the different mechanisms for direct cash aid. Next slide, please. So currently, there are 7 statewide pilots that are underway, or have already been completed in San Francisco, LA, Southern California, and in San Joaquin County. Focused on former foster youth, pregnant individuals, and a newly added target population, which is older adults, where participants are receiving unrestricted monthly guaranteed income payments from about $600 to $1,200 over 12 to 18 months. And these paths are possible because of the 2021 state budget, which allocated $35 million over 5 years to these statewide pilot programs. Um, and in these pilots, participants, in some of the preliminary like focus groups, participants anticipated additional cash would enable them to pay down debt, support their ongoing needs and expenses, and help to make decisions about like long-term employment and education to really help set them up for the future. But a lot of this data is still being evaluated and the full findings haven't been released yet, but we're hoping in the next year or two. Next slide, please. And then sort of adding to the current landscape, just want to acknowledge that there are a lot of attacks on our various communities currently, from our immigrant communities with ICE and ICE kidnappings, data sharing, um, public charge rule changes, etc. We're seeing attacks to trans youth and trans access to healthcare, and attacks on reproductive rights, like increased criminalization of homelessness, and really uh, just chipping away at our SNAP and Medi-Cal programs as well. So a lot of communities are losing access to government safety nets and are being targeted in other ways. So I think this is just one thing to keep in mind as we consider guaranteed income, um, advocacy, and think through some of the narratives around guaranteed income and our safety nets. Next slide, please. Um, Also, for some context, having advocated for guaranteed income at the state level, there seems to be a growing popularity of guaranteed income in the legislature when we're actively cultivating champions like Assemblymember Lee. He authored AB 661, which was a bill that we ran last year to try to set up the state to move from pilots to actually figuring out like what a long-term statewide guaranteed income program could look like. And then also more broadly speaking, there is more of an awareness around um, universal basic income, thinking back to like Andrew Yang and his political campaign, which kind of seemed to put it on the map. And we're starting to maybe see more political buy-in there, although that's also a little challenging. And then just also seeing a lot more guaranteed income pilots popping up in a lot of cities across the country. So it's becoming a little bit more widespread, more known. And then also in this moment, it's hard to just ignore the impact of artificial intelligence, and just seeing how this technology has really changed the nature of work and is displacing a lot of workers, arguably at a pace that we haven't seen before with other technologies. And with that, there's like some conversations around like maybe there should be an AI dividend where we pay everyone for their contributions, their human knowledge and capital that these models are being trained off of. Um, so there's that. And then just briefly, like there continues to be ongoing state budget deficits and instability, that remains like an ongoing concern and challenge, um, that that we are trying to navigate as we think about the possibilities for like future state programs and, um, existing, expanding or sort of transforming our existing public benefits systems and guaranteed income programs. Um, Next slide, please. So thinking to what the future of guaranteed income could hold or what that could look like, I think first and foremost, narrative change is going to be really important here. Currently, we're often seeing, like a moral or human rights frame, or narrative where, we want people to have a right to thrive and, to self-determination and centering dignity. And I think this like should continue to be part of the narrative. Um, and also, just there would people talk about like maybe guaranteed income or just like cash transfer. We hear people talk about redistribution of wealth, um, and or sometimes that can also be framed as like a handout. Um, and I think it's helpful to contextualize and call out, just the extreme wealth inequality and stuff that's happening. But at the same time, that doesn't always make it easier for to get public buy-in or to at least overcome the shame and stigma that often comes from like the history, the decades of like racist and negative stereotypes around like welfare queens or like a nanny state and government overreach that's tied to like American individualism and our bootstraps mentality, where the poor are often treated as undeserving or lazy, etc. So just with all of this in mind, I really wanted to, um, just call attention to, like a narrative reframe that I thought was really interesting, that I heard from Dr. Ryan Semery Palumbo. He's currently at the Economic Security Project, but he, put together a report or a paper on recovering wages and wealth. In that he calls attention to, just like in light of the rapidly changing like AI economy and, where people are being like severely underpaid. Um, just he argues that we need to change the narrative around guaranteed income and reframe it as recovered wages for all the wealth, that has been extracted from American workers over the past like many decades. And that has largely only benefited the ultra wealthy and large corporations and their shareholders. So reframing this as like money that has been stolen from workers and money that has been earned, and we're just recovering that. And he shares like an interesting statistic. Um, and it's the amount that working people have lost and that we're trying to reclaim is massive. Since 1975, by Rand's accounting, policy choices have redirected $79 trillion in income growth away from 90% of American workers to the top 10%. Over the course of a career, that compounds to nearly $1 million per worker. So that's a huge amount of money that has been extracted from workers. And then just to try to wrap things up really quickly, at the same time, guaranteed income is just one tool in our anti-poverty toolbox, and it needs to guaranteed income can only supplement, it cannot supplant like our existing safety net systems or addressing other systemic issues beyond that. So we really need to address like the cost of living. Also, the limited program duration is a limitation of guaranteed income and is not necessarily enough to build long-term wealth. There continues to be a benefits cliff for many of our social safety net programs, and without protections for around like guaranteed income, people may be at risk of losing those other supports that are really vital. And yeah, again, like there's those systemic issues like housing affordability, wage gaps, lack of access to childcare, et cetera, that reinforce the need for sustained investments and support in our safety net system and beyond. So with that, I will, or next slide, please. These are just some resources for you all that you can access once you get a copy of the slides. But with that, I will hand things off to Keely.
Awesome. Thank you, Whitney. That was great. I feel like I learned a lot. And I'm going to talk about how we create a future of shared prosperity and build an equitable state budget that funds everyone's right to thrive. Also, introduce myself. I'm Keely O'Brien. I'm a senior policy advocate here at Western Center. So, to start off, what happened last year when the federal government passed HR 1? Many of you have, I'm sure, heard of it as the One Big Beautiful Bill, and named in the Orwellian tradition of doublespeak. Obviously, there's nothing beautiful about it. You can go to the next slide. But it was definitely very big. In fact, it was the single biggest transfer of wealth from the poor to the rich in US history. So, as you can see here, it really represented a calculated economic warfare against anyone who's not already wealthy and the intentional destruction of our safety net. So, it quite literally transferred $1.5 trillion in the cuts to our healthcare and food assistance systems and gave that away in the form of massive tax windfalls to people with incomes over $500,000. And it did this while also adding billions of dollars to our national debt. So the federal because I focus a lot on food justice issues, I'm really going to focus in on the food assistance part of the safety net cuts. But about about a trillion of the 1.5 trillion that was cut was actually from healthcare. So it's 0.5 trillion that was cut from the food assistance side. So how is that going to impact us here in California? We are about to see about 707,000 people here in California completely lose access to CalFresh food assistance. These are extremely low income people who need this money to pay for their groceries. So we're talking about 34,000 refugees, asylees, survivors of trafficking. Nearly half of them are children, seniors, and adults with disabilities. They're completely losing eligibility for CalFresh. In addition to that, more than 600,000 Californians will now be subject to CalFresh time limits, limiting them to only 3 months of CalFresh food assistance unless they can prove that they work over a certain amount of hours every month. That includes former foster youth, seniors, unhoused people, veterans, and 49,000 parents with children ages 14 to 18 who are no longer being considered dependents under this rule by the federal government. As a result of these cuts, children, parents, seniors, unhoused people, foster youth aging out of the system, and veterans will all lose the food assistance that they need. You can go to the next slide. So these cuts are hurting people, like I said, who are extremely low income and rely on this CalFresh funding to pay for groceries. A survey that the amazing Rebecca Miller worked on last year of over 600 CalFresh recipients found that people already cannot meet their needs even while they're getting CalFresh benefits. So when people get cut off, what does that mean, right? What does that mean for their family budgets? It means that they're not going to be able to afford other things. You can go to the next slide. It means that they're not going to be able to afford the medications or healthcare they need. Food insecure children are 2 times more likely to be in poor health. Adults spend 45% more on healthcare, and seniors are 23% more likely to enter a nursing home after they lose food assistance. On the education side, kids are going to get worse test scores, and they're going to be way less likely to graduate from high school. High school graduation rates are improved by almost 20% by SNAP benefits, and we're cutting kids' parents off when they turn 14. So we also know that when people lose food aid, they stop being able to afford rent, so they might get evicted and become homeless. They stop being able to afford utilities, so their power gets shut off. And this is really destabilizing for families. When they can't meet the basic needs of themselves or their children, they're far more likely to get pushed in the child welfare system. And this is also going to cause people to die. The Center for American Progress estimates that cuts to CalFresh will cause 4,000 avoidable deaths just among parents with children and older adults impacted by the time limits by 2040. And all of this to pay for what? For the top 1% to enjoy a windfall of over $1 trillion over the next decade. It's not a very good trade-off, in my opinion. So, how do we protect California from this using our state budget? It's really a four-step process. What we need to do is we need to unrig California's tax code as a first step. Many of the billionaires and corporations who receive the biggest tax windfalls from HR 1 are right here in the beautiful state of California. So we have the chance here to fix our broken tax code, which already unfairly benefits the wealthy and corporations, and even it out and make it equitable. We can claw back a bunch of those revenues that the federal government said they don't need, and we can use them here in California to fund the things that matter. So, step one, adopt progressive revenue solutions. Step two, keep people on CalFresh. As much as possible, we need to keep drawing down those federal dollars. Step three, provide state food aid for anyone who's losing CalFresh. We can't allow people to go hungry just because the federal government says so. And step four, continue to support our emergency food safety net. So, what did we actually get in the budget? We made some progress on unregging our tax code. We really funded keeping people on CalFresh. We got no funding for state aid for people losing CalFresh, and we really successfully supported our emergency food safety net with more funding to the food banks. So we can get into a little more specifics. We did adopt several revenue solutions. And overall, it's going to raise more than $5 billion ongoing. That's awesome. The business tax credit cap, I think, deserves a special shout out, along with the fair share contribution. There, we didn't get the fair share contribution, but we got progress. What we actually got was Department of Finance is now required to draft a bill and provide us with options on how to move forward with the fair share contribution. And what that is it would require corporations that make their employees benefit from this type of healthcare to actually contribute to that healthcare. And so a lot of work is ahead here. You know, the revenues that we're gathering are really just a drop in the bucket for these major corporations and for the billionaires. So there's a lot more work to do here. As far as our wins, we were able to successfully fund investing in CalFresh outreach and supporting our county eligibility workforce to keep people on CalFresh. But like I said, we were not able to get funding for state food assistance. So we didn't get any funding to protect the 34,000 humanitarian immigrants or the 600,000 Californians who are getting cut off from CalFresh. we did fund, like I said, the food banks and the diaper banks, which is great. But we really still need more funding in this state budget. And we're looking right now in August I know it's not August yet, but in the August session, we're really looking to get some additional funding to protect people from these cuts. And this is a revised ask from what we were asking for before. What we're asking for now is really just to protect the humanitarian immigrants by including them on the existing California Food Assistance Program and to protect families with children who are impacted by the time limits by just providing an extra CalFresh benefits to the kids who are still on CalFresh when their parents get removed as a result of the time limits. So we have really a lot more work to do to create a state budget that is truly equitable. You know, we made some progress this year, but we're not where we need to be. We need to invest much more in our safety net, and we need to unrig our tax code. And that's all from me.
All right. Well, what an amazing assortment of efforts that our state needs to do to support people and their well-being from so many experts here. We wanted to not lose the opportunity to give them an opportunity to say, what else do you think we need to support everybody's right to thrive? And how can we make these visions a reality? Who wants to start?
I feel like there's like a really important thread, and thank you so much, Whitney, Keely, and Sandra, for those just really inspirational presentations. Even the parts that were the cautionary tales about the things that have gotten worse in this moment and there are significant challenges. I think this idea of a narrative change running through these that I heard in all three of the presentations about that not that this isn't a handout, this isn't like providing assistance, but this is more of a recovering of everybody's contributions into the system, and how we can continue to do that work. And so, just like Sandra's slides about how the Colorado single payer health system lost by 80%, and I think, the people who voted this time for the current federal administration who lost healthcare. And I'm curious, like, more from any of you about like messaging that has helped that sort of like fairness. I think Social Security comes like to mind of like people thinking of that's like a legitimate thing that we've all worked for and paid into, and how can we have that same messaging in some of these other systems that provide dignity to everybody in California.
Right. I was thinking when I first saw that question, the word that popped into my mind was courage. Because we get comfortable doing things the way they've always been done. And then you have those that want to keep those things in place, have the money to kind of influence the messaging that helps. So I think to me, it would take going to some of these folks that have, in the case of single payer, those countries that have been successful and find out what their best practices were. I'm sure they ran across some of the same issues that we have, the fear about higher taxes and more costs. But we need to be able to really show data on how it can improve costs and lower costs for folks. So to me, it's just having the courage to think out of the box and think long term what the benefits would be.
Um, for guaranteed income, I think, yeah, Rebecca, I also noticed the same thing of just the through line of there needs to be a narrative change of how we talk about these programs and shedding light on like the immense inequality and just like wealth that has been extracted from our working and low-income communities. Um, and for guaranteed income, one thing that I've been sort of thinking through and just haven't quite come to a conclusion yet, but it's just like the trade-offs between like a program that is more universal, like you mentioned, like Social Security, like almost everyone sort of pays into that and benefits from that. And because of that, it's been like extremely difficult to dismantle. I heard that just in doing some of the research and reading through Dr. Ryan Summary Palumbo's paper, he mentioned that there were other models for how to do like a Social Security program that were actually more cost effective to run, but um, just wouldn't maybe not get as much of that public buy-in, which I thought was really fascinating. And so I think that's like something to consider. But on the other hand, like they're just the idea of like we need to target our programs to benefit those with the most need and not like a blanket program is may not be the best model to support people because everyone's needs are different or different populations have different needs. So yeah, just uh, like wondering like how we find the balance as we think through like what a future guaranteed income or like direct cash program could look like in our state.
Well, plenty of things for us to keep thinking about, keep pushing for. Keely, we heard from your presentation, unrig the budget. Is there anything you wanted to add?
No, I feel like I was also thinking about, really the core of it is why are people poor? Why are people low income? Why are people unable to afford the things that they need? And it's because their wealth is being extracted because their labor is being extracted for much too low of a cost. So I really love the idea. I'm looking forward to looking into the research that Whitney brought up about recovered wages. And I think it's really, yeah, a critical framing that we need to uplift.
Excellent. Well, I think we wanted to provide just a brief opportunity for any questions or comments from people who've joined us today.
Since this is the last session, I did want to thank you guys for the summer training series. I know I always have a trouble with my Zoom, so my camera's kind of trying to pop on right now. But anyways, on top of like Keely's, you know, how do we think about systemic changes and everything? I think from my point of view and my lived experience, what has been helpful for me in this kind of like pivotal time is just knowledge and empowerment. And especially through sessions like this, it's like, oh, the knowledge that um, would benefit a lot of people who aren't having to deal with the system is even knowing this information in general. Because then the power and giving people the knowledge to utilize their voice to sway legislative, decisions and everything. I think that's a lot of like what we need right now is a lot of empowerment to those people being affected. Yeah, my 2 cents, but thank you.
Yeah, thank you. I think you saw a lot of nodding. So thanks for being with us this summer to, you know, share this information. Any other questions or comments before we start to wrap up? Okay. Well, we just wanted to remind you all that all of our trainings from this summer are online. You can watch them, the recorded videos. This recording will be up there very soon, so you can watch it anytime you want. And then we wanted to make sure also that you have the information about filling out the survey for an MCLE. So that's been posted into the chat, and we'll post it again. Make sure you fill that out for your credits for MCLE. Anything else before we wrap this up? All right. Well, super big thanks to all of the speakers and panelists. Thank you all for joining us today. Take care.